The very traditional model of care has been brick and mortar clinics where you own a building and patients come to you. And I think that what we're doing differently is really trying to find ways to center the patients more and what their needs are.
Just the Pill was started in the middle of the pandemic when access was changing. We were trying to keep people out of the clinic. The original idea was to bring services to the patients with a mobile clinic. The laws changed. We were able to mail medication abortion pills.
We were able to step up because this was how we began through telehealth and medication abortion. So COVID was in some ways an opportunity to really expand and bring attention to what we're doing.
Abortion care, it's heavily restricted in a lot of ways, and it creates a lot of barriers for people in accessing it, and Just the Pill works to do what they can to limit the effect those barriers have on the patients.
Roe was just a skeleton. It's always mattered where you live and how much money you make and how accessible abortion care is to you.
Our ability to be nimble and to be mobile and to work through telehealth, it is really a new model of care.
Helping patients who are having to travel long distances. Do we meet them on the border? Are we working on travel for patients, getting close to the airport? How can we make sure our services are expanded to everybody?
And to destigmatize abortion care and to ensure that it's, like any other health care, it's something people can access in their community where they need it.
I always tell people, say the word.
Abortion, it's general, essential medical care, and it should be talked about in that way. It's about 60% of our patients already have kids at home. Some people have had long-acting contraception. They're trying to prevent pregnancy, and that's not 100%. It's their decision, and it's a private decision. Having laws that obstruct this really put pregnant people's health in danger.
I'm from rural Minnesota myself, and when I was very young in my 20s, I had a miscarriage that was very much an unwanted pregnancy. And I remember at that time being very young and in a small town, not having any idea where abortion services would have been accessed. There were all these rumors about, well, you can go to the cities to get that done, but at that time I was living in my parents' basement and not sure how that was even something that could be accomplished. The idea that people from my hometown even have accessed services from Just the Pill, and I've had people been able to come to them to provide these services, really means a lot to me.